A doctor stabbed an ice pick through thousands of people's eye sockets, scrambled their brain tissue and won the Nobel Prize for it. The medical community gave him a standing ovation. It's the 1930s. Mental illness is poorly understood, massively stigmatized, and institutional asylums are overflowing. Patients with schizophrenia, depression and anxiety are locked away indefinitely. Doctors are desperate for any solution that works. Enter Antonio Egas Moniz, a Portuguese neurologist who becomes convinced that mental illness lives in the frontal lobe, and that severing its connections to the rest of the brain will cure it. He calls the procedure a lobotomy. Early results seem promising. Violent patients become calm. Agitated patients become quiet. What he doesn't mention is that they also become something less than human. An American doctor named Walter Freeman takes the procedure and runs with it. He develops the transorbital lobotomy, a faster, cheaper method where he inserts a modified ice pick above the eyeball, taps it through the bone with a small hammer, and sweeps it back and forth to sever brain tissue. The whole thing takes 10 minutes. No operating room required. Freeman performed them in his office. He lobotomized over 3,500 people. He took his procedure on the road in a van he called the lobotomobile. He performed them on children as young as 4. Patients weren't cured. They were emptied, stripped of personality, emotion, and independent thought. Many required full-time care for the rest of their lives. Some died on the table. Moniz won the Nobel Prize in 1949. Freeman lost his medical license in 1967 after a patient died on his table, his 3rd death in a row. Medicine called it a breakthrough. The patients called it something they could no longer articulate. History's full of unforced errors. Follow for more.